On behalf of the Seeds, today I will be talking about the Vancouver drug policy. Here is a brief history of the drug policy in Vancouver. Vancouver, the west coast seaport in British Columbia, is among Canada's densest, most ethnically diverse cities. The downtown east side of Vancouver is among the most impoverished urban neighbourhoods in Canada. It is known for the drug overdose deaths and other health complications of drug since 1970s. It is estimated that there are approximately 5,000 injection drug users living in the downtown east side of Vancouver. In 1997, there was an explosive HIV epidemic that prompted local health authorities to declare a public health emergency. As a response to the emerging health crisis among injection drug users and government inaction, individuals gathered in Vancouver to form a drug user-run organization. This group was eventually known as the Vancouver Area Network of Drug Users, or VANDU. The philosophy of VANDU is user involvement and empowerment. VANDU conducted many campaigns, educated people, and organized many public demonstrations in an effort to bring attention to the health emergency in the downtown east side of Vancouver. The continuous efforts of VANDU gained recognition from health authorities, local communities, and policy makers. Membership. The VANDU consists of 15 board members and a staff of 3. There are full membership and supporting membership. Full membership is given to people who report using or formerly used illicit drugs intravenously. The second type, supporting membership, is given to any person. Monthly general membership meetings are conducted. The advantage of VANDU is that the organization is user-run, that is, all the members are formerly or are currently drug users. Activities of VANDU. VANDU has been involved in several education and harm reduction initiatives. VANDU adopted the 4 pillars drug strategy, which was first implemented in Europe in 1990s. The 4 pillars are harm reduction, prevention, treatment, and enforcement. First, harm reduction. The goal of the 4-pillar drug strategy is to reduce harm to individuals and communities from the sale and use of both legal and illegal drugs. The principles of harm reduction is that we do no harm to those suffering from substance addiction, and that the focus is on harm caused by problematic substance use rather than the substance use per se. Vancouver's harm reduction program include the supervised injection site, needle exchanges, and low-threshold community health services. Vancouver has a 24-hour-a-day access to needles through low-threshold, peer-based needle exchanges, mobile exchanges, and needle exchanges attached to primary healthcare services. Harm reduction interventions have proven successful in decreasing the open drug scene, the spread of HIV or AIDS, and hepatitis, overdoses, and overdose deaths. Second, prevention. The prevention pillar includes strategies and interventions that help prevent harmful use of alcohol, tobacco, and both legal and illegal drugs. The goal of Drug Policy Prevention Plan is to reduce individual, family, neighborhood, and community harm from substance use. delay onset of first substance use, reduce the incidence and prevalence of problematic substance use and substance dependence, improve public health, safety, and order. Of the four pillars, prevention requires the greatest amount of commitment and collaboration across all sectors of the community over a sustained period of time to show significant results. In a long run, prevention will have the greatest impact in reducing harm from substance use. Treatment. The treatment pillar includes a range of interventions and support programs that encourage people with addiction problems to make healthier decisions about their lives. Treatment improves health by decreasing preventable deaths, illness, and injuries while improving social integration. The treatment services delivered by Vancouver Coastal Health include core services at the community health centers, withdrawal management, residential and non-residential services. Fourth, enforcement. The enforcement pillar of Vancouver's four-pillar strategy recognizes the need of peace, public order, and safety in the downtown east side and other Vancouver neighborhoods. History tells us that policing alone is not a solution to Vancouver's drug problem. An integrated approach, including prevention, treatment, harm reduction, and policing, has proven to be effective. The Vancouver Police Department endorses the four pillar strategy and its principles. The four pillars approach has resulted in dramatic reduction in the number of drug users consuming drugs on the street, significant drop in overdose deaths, reduction in the infection rates for HIV and hepatitis. In most places of the world, the drug addicts are treated in a very bad manner. They are abused and are not even respected as a human being. This must change. VANDU is the best example of a properly implemented drug action. The drug users suffer a lot. The VANDU members are considered as the voice of intravenous drug users. The VANDU has played an enormous role in changing public perception of drug users. We, the seeds, remind you: support, don't punish.
Nothing